So join me today on episode 38 of Taking Charge of My Cancer podcast. I have with us a very special guest, Carolyn Vachani. Carolyn is an oncology nurse and the innovation director at OncoLink. In this role, she develops and maintains innovative projects to make providing quality patients education more attainable. She leads the development and maintains of the OncoLife Survivorship Care Plan and has a strong interest in oncology survivorship care, cancer education, and health literacy. She is pursuing a certificate in therapeutic horticulture and loves learning how plants can improve health and wellness. She enjoys discussing just about any cancer topic, as well as gardening, cooking, and of course, her sons. So thank you so much, Caroline, for being here with us today.
Thank you. Thanks for having me.
Absolutely. So you want to tell us about your role and were you ever plan to do this?
Sure. So I began my career as an oncology nurse, actually 30 years ago this year.
Wow, congratulations.
And thank you. And I quickly saw that education was a really important part of being a nurse. And I guess I really didn't realize that until I was actually in the job. And it kind of tapped into the side of me that always thought maybe I'd want to be a teacher. And so I worked on a unit. We saw a lot of patients with leukemia and other blood cancers. And so many of them were really just blindsided by this cancer diagnosis that kind of came out of nowhere. And they were, thrown into this world of a whole new vocabulary. And I saw how teaching people about their diagnosis, what was coming next, what would they expect to happen tomorrow, really helped provide comfort to people and take away some of that anxiety of the unknown. And so I really got involved in patient education in the health system I was working in. And then one day ran into a girl I had worked with many years prior, and she was working on this new thing called a website. And she said, you'd probably like this because you're really interested in patient education. And I joined the website full-time in 2001 and have been doing that ever since. So did I always think I would do this? Definitely not, because the internet wasn't even around when I went to college. But given my interest in education, I think it ultimately was really a natural fit for me.
That's awesome. So do you miss at all the clinical part of it?
I do. I still have friends and family members who will, give my number to people, and people will call me for help or guidance. And, that kind of takes a little piece of that. But yeah, you sort of become a nurse to be able to, leave work every day knowing you made a difference in people's lives. And you being a virtual nurse, you sort of lose that. But you just have to, in the back of your mind, know that now you're reaching, thousands and thousands of people.
Yeah. Well, I'm telling you, I start kind of like looking and follow your webpage, and you guys put a great information in there. I've been really learning tons of it. So, it's not just education to patients, but, all of us on the healthcare system, really, you will learning. This is a and when you're thinking you get something down pat, guess what? Now things changing day after day after day, which is exciting because it's like you have to kind of keep on your toes. So that's great.
Yeah.
Were you always planning to do this?
But, not really. I really guess I hadn't thought much beyond, once I became a nurse. I thought I would just, I guess I didn't know there were so many jobs that nurses could do that weren't, what you see a nurse as, somebody in the hospital taking care of a patient. And so I probably wouldn't have never thought this because I didn't even know it was possible. So it's kind of been fun to see how over the years the website has grown, and I've gotten to work on different projects and developing tools and applications. I never would have thought I would have done all that.
That's great. Can you give us any valuable tips for cancer patients?
Sure. Well, I think the most important thing that anyone can do with not even just a cancer diagnosis, but any health diagnosis is to educate yourself. And by educating yourself, you allow yourself to be an advocate for yourself. And, as many of people who listen to this podcast probably have already experienced, you meet with specialists from all different areas, and your time with them is often limited. And if you come into that appointment without really understanding the words they're using or the basics of your diagnosis, then you really can't maximize that time with them. Now there's a difference between, doing a little bit of education to learn about your disease and, Googling for hours and reading everything you can get your hands on. So I think, to start, people should at least go learn a little bit about the type of cancer you had. What are the possible treatments you could be offered? Is there biomarker testing, which some cancers have? Knowing a little bit about what might be coming can help you when you're in those appointments. I think of men diagnosed with prostate cancer as a great example that they may be offered 2 or 3 different treatment options, and they have to take what they learn and make that treatment decision and feel good about the decision they make. So they really have to start to find out what are the pros and cons of each decision, knowing that whatever I pick is the right thing for me. And you can only do that if you've educated yourself.
Yeah. Sorry, go ahead.
And I would also say, as using those guys with prostate cancer as a example, if a man with prostate cancer goes to see a surgeon and they recommend surgery, and that man doesn't do any other homework to know that radiation could be an option, implants could be an option, they may just proceed with the surgery, not knowing that there were other options out there for him. So that's another way to think about the importance of education.
And I would like to kind of tap to that as well. Really kind of make sure that you know where your education is coming from, right? So Dr. Google can be a great thing for so many things, but sometimes it's not that great of a friend from other things. So always know that whatever you're searching is really coming from, base evidence, like hospital-based, research-based, links like you guys, OncoLink, all those things that is all this research behind it, and it is not just information. Because sometimes when you go into Google, or sometimes support groups can be great, but sometimes can be bad because people just gonna tell the experience, and if you have a bad experience, you're gonna share that, and not necessarily it's a bad experience for everybody. So just really make sure that you have a really good kind of like source of information that that is truly like medically kind of backing up.
Yeah, we don't want Aunt Susie's blog.
Exactly. Exactly.
Everybody has a friend, relative, neighbor, or something they want to tell you about, and their story is probably not at all relevant to your own.
Exactly.
Even if it was the same type of cancer, we sort of don't realize until you're in it that a diagnosis of lung cancer is not the same for every person. There's so many different types and subtypes and genetic markers. So what happened to the guy down the street is really irrelevant to your situation.
That's exactly right. What about a painful lesson that you learned along the way?
I think just seeing that care is not equal everywhere, and it's really disheartening to see the inequities in care. Just getting in to see an oncology specialist. If I need to see an oncology specialist, I call somebody at the hospital and they know somebody who gets me an appointment. Not everybody has that kind of access. And it's really sad to see that in this day and age in our health system that we can't do a better job of making access available to everyone. And really like knowing that you're getting good care wherever you go. It's not always the case, which is another reason why you have to educate yourself, because you are the backup plan.
Exactly, that's right. And then that was another really thing that I'm totally agree with you. Sometimes I work here at UF in Gainesville, and we have patients that comes from other institutions, right? And sometimes they're like, oh, we are like the third opinion, right? That they're looking for. And I always tell them, this doesn't, regardless if you come to UF or not, always search for that multidisciplinary team. You want to have, 5 heads thinking about your situation, not just one head making decisions. So it doesn't matter if it's Moffitt, if it is whatever it is, but you have to really get with a multidisciplinary team that can put all those pieces of the puzzle together, and that's why you're going to have your best care. So that's important for them to do that research too.
Yeah.
What does it mean to advocate for yourself, and how can people do that?
So the definition of self-advocacy is the ability to communicate your needs. And so that can really help you feel more confident about your care that you're getting and the treatment decisions that you're making. There's still a lot of people out there, whether it be just old school beliefs or cultural beliefs, that the doctor knows all and we shouldn't question them. There's a way to question that is not disrespectful, but really oncology care should be a partnership between the patient and the providers. You are the center of the team, you as the patient, and you need to be able to speak up for yourself and tell them when something is not working right for you or affecting your quality of life or the ability to do things that you want to do. Maybe you want to go on like vacation. I hear that all the time where people will say, well, we canceled our this cruise we've been waiting to go on for 3 years because of my diagnosis. But in reality, most oncology providers in most situations, not all, of course, there are some where this would not be possible, but they will work with you to work a treatment plan around something that's a big, important event or family trip or a wedding or whatever the case may be. But they can't do that if you don't speak up and don't tell them. And even in my own family, I see this happen with my dad, that his doctor made him an appointment, and it was the middle of the week we were going on vacation with the grandkids and the whole family, and he said, well, I can't go now, they made me an appointment for that day. I'm like, well, you just have to tell them you're going on vacation. He was like, I can't do that.
Yes.
Unfortunately, people still think like that, but no, they don't mind. They'll give you an appointment the following week. And sure enough, when he called, they were like, oh, no problem. We'll move it to the next week. But he would never have asked that question had I not pushed him to do it. So just speak up. People, your care team wants to help you and they want to make it the best experience that it can be. But they can't do it if they don't know what you need.
Yeah. And it's funny that you mentioned that. I have multiple patients who, okay, I have, I just got diagnosed with breast cancer and I'm kind of trying to schedule surgery. And then kind of mentioned to the breast surgeon is like, I'm having a cruise or I'm planning to go to Europe for this to this. So I have these 2 weeks to do surgery. Can I swing this in these 2 weeks and I'm recovering enough to go? And really, I have seen our breast surgeon is amazing, and she really will do everything possible for that to happen. And she will just move the surgery whatever they can, stay late if she needs to, so this patient can continue move on with their trip and their life, and not just put a hold on all this. So yes, you're right. That's just kind of like explain that to your care, to like your clinical, physicians, and then they will try if certain situations that you may not be able to, but
sure. Yeah, though, the people we took care of in the hospital who were in with leukemia and newly diagnosed, yes, you cannot go on a trip, but in many cases they'll find a way to work around it. And really, if we don't learn anything from cancer other than don't sweat the small stuff and just appreciate everything you get in the day. So that's even more reason to take that trip or get to that wedding or whatever it is you want to do.
Yes, absolutely. Totally agree with you. What are good resources for patients to use to educate themselves?
Yeah, as you mentioned, we really want to be careful about where you're getting your information from. There are a lot of advocacy organizations. There's organizations for every type of cancer out there. So find the ones that are specific for your type of cancer. Often they will have programs where they can connect you with a buddy who is somebody who's had the diagnosis and gone through treatment and can kind of help guide you or provide advice to you. That's a great resource. Generic cancer websites like OncoLink, of course, the American Cancer Society, ASCO, which is the American Society of Clinical Oncology. Their website is cancer.net. They also have a great website. And, the pandemic gave us all a crash course in how to attend online programming. And now all of these advocacy organizations offer online webinars and support groups, all kinds of sessions. So now we know how to do it. We can connect with people, across the country if we need to.
Okay, that's very good source of information. How can people find you?
Probably oncolink.org. So we have a list of all our editorial board, and I'm on there, and all the contact us emails come to me. So I would get any email they send me.
Perfect. And I will add that into the description of the podcast as well.
Awesome.
What is one question you wish I will have asked you, and what will you have answered it?
I don't know if this is totally a question, but you had mentioned in the beginning, I'm doing a certificate in therapeutic horticulture, which is something I've always been very interested in, gardening and plants, and the pandemic really made me see how much I relied on that for my own mental well-being. Going through, lockdown and having kids homeschooling and trying to work and all that stuff. And I would just go say, leave me alone. I'm going in my garden. And, 20 minutes in the garden, and I felt so much calmer. So I really saw that connection and then realized, wow, this is an actual field of interest that people pursue. So I'm getting a certificate in that. And I think it's a great way for people who are going through cancer treatment, dealing with that anxiety, worry, fears, to take a walk in nature, work in the garden, just visit a garden. And it accomplishes a few things because it can help you relax. It can help you be more mindful, but it also provides some exercise sort of without it feeling like forced exercise.
Mm-hmm.
And we know that exercise is one of the few things that really helps combat cancer-related fatigue and losing muscle mass and strength during cancer treatment. So if taking a walk in the garden is what gets you going, then I'm all for it. Go get it. So I'm hoping your audience will hear that and sort of tap into nature to help your mental and physical health.
This is so great that you actually mentioned this, because we actually have the Women's Gardens in here. And actually, I'm doing a podcast with her this week.
Oh, with Lee. Okay.
All about horticulture. So I was
That's wonderful.
when I saw that, and it's like, this is just the beginning of just going deep into that. And you're absolutely right. That has been, we recommend that to patients. We have a beautiful garden out here. And then, patients see us and then see radiation or see medical oncology. So we tell them just instead of just sitting around on the waiting room, just go and walk on the garden. That's great for your spirit. We actually time it. Like if you do so many laps, this is how many miles. And we encourage them to do certain like little exercises on the benches. And it has been really like great. And then they have a great like cancer support groups in there, spinal cord injury, like all these different groups that go and do socialization, work on the plans, have their project, they do cells. I mean, it has been really fun. So yeah, it's exciting more about it.
We are based in Philadelphia, so our center's in the middle of town. It's busy city, and it can be really overwhelming for people just to get there, to have to drive in that traffic and find a place to park and all that. And people don't realize, I ended up making a little brochure to put in the waiting rooms, because there are all these really cool gardens on the Penn campus that you wouldn't even know were there if you didn't, someone didn't tell you. But they're certainly, if you had an hour to kill between appointments, you could certainly take a walk over and look at the gardens. And yeah, I think we just don't tap into that enough.
Yes,
it really does help our mental well-being for sure.
So, a good idea for you. So years ago, I have a student now, she's one of my colleagues, and part of her, like they do like a project at the end of their internship, was about developing this brochure and explain why that was important. And actually in the brochure was a little map where they were. And then she add to that, like you will stop, like if we have different bench, so let's pretend you just walk and then you do kind of like sit to stand as an exercise. But then she added like, then you want to think about a good kind of like feeling, or just kind of be thankful for something, or just think like a good positive thought and say it loud into the next. So that, and she kind of put all that together and give them examples of those kind of thoughts, but it was very personalized. So we need to get back into it. We've been forgetting to do a lot of that, but yes, so that's maybe something you can implement over there. So that will be really good.
Yeah, it's because it's a shame you see people sitting and waiting in offices for all this time, and you think, just stretch your legs, take a little walk. It's
yes, that's true. That's absolutely true. I wish I was in Philadelphia about 2-3 weeks ago for the NLN conference. It's like, oh my God, we could see each other there and then find meet person. So that was a nice. We were in downtown, so I didn't have that much time to do some little sightseeing, but that was nice. I went like over 16 years ago and was more on the outskirts. I really didn't remember much of the city at all. So that was kind of a nice, like 6-hour walk all over the place, tried to see as much as I could before the conference. So that was nice. I really like it. So yeah. Well, thank you so much. I really appreciate you being with us. You really gave us a lot of great value information. I'm sure patients will really appreciate when they listen to this, all the different resources that they can go and check things out. So again, you guys doing an amazing work, and thank you for that.
Oh, thank you. Thanks for inviting me. And yeah, hope to see you all over at OncoLink.
Okay, perfect. Thank you. You have a great evening.
Thank you. You too.
Bye-bye.